Hi, Dr. Zahra. Well, I'm actually here with you, and also we have Ricardo on the line, and we're gonna continue our topic on sexual rejuvenation or sexual dysfunction. And actually, Ricardo, I brought him up because he has some questions that he would like to ask you from people that he knows, and with this situation.
You bet. Thank you, Francis, for having me again, and I welcome any and all questions from Ricardo. Nice to make your acquaintance, Ricardo.
Same here.
Okay, Ricardo. So, what we were actually talking, you and I, about sexual dysfunction and the people that we know. And so, what do you shoot the questions to her about the things that we were talking the other day?
Well, first thing, I meet a lot of people who are really not familiar with it or comfortable enough to get treatment for what we call erectile dysfunction, things of that nature. So I like to help other guys out. I have a lot of older friends that it's a very, very touchy topic, so people want to know exactly how to go about when you have a friend who's like, I need some help, I'm a little nervous to get the help. What should be the approach to that?
That's a really good question, Ricardo. So I think information and education and being armed with the most that you can find out about a condition, and in this case erectile dysfunction or sexual dysfunction in general, I think it's really important to be well informed. So in terms of how to begin or where to go from there is first we would, as a physician or a clinician, I would want to know the root cause of the problem. So when we speak about erectile dysfunction, it can be due to many different causes. So it can be due to diabetes, a diabetic condition, or a similar condition where circulation is compromised. Okay, that is one. Or it could be a cardiovascular condition, again with the compromised circulation and a buildup of plaques and in the arteries and in the that require the circulation in that part of the body for proper function. Or it could be psychogenic, meaning that it could be a psychological, emotional issue, or it could be hormones. There are many different causes. So the first step would be to ascertain what is the cause and then address it that way, and in a very comprehensive fashion, which we do at the Stem Cell Healing Institute.
I see. Very good information. Is there also, is there medication? I know the traditional medication, the Viagra and Cialis and things of that sort, but I've been hearing about so many different, these internet companies who are shipping discreetly packaging. Are those medications, do they work? Are they something that people should seek, or should they seek more of the traditional clinical medication, the Viagra or Cialis?
You know what? That is an excellent question, Ricardo. You know what? A lot of these medications, they work. They do work. They work very temporarily, and they work symptomatically. So when a male can't have an erection, for instance, the medication may help temporarily for him to allow to obtain an erection and sometimes even maintain it. However, it's not getting to the root cause of the problem, and over time it's either doing more damage or you're requiring more medication to obtain a certain result. Okay, so a lot of these pharmaceuticals, they're symptomatic and they work in that temporary moment, but we're not addressing the root cause of the problem. With stem cells and with a very comprehensive approach of perhaps stem cells and which actually heal the body, which actually we're looking to cure the body of why this is happening. Okay, so we're getting to the root cause. And then we use things like adjunctive therapies like oxygen, hormone therapies if we need them after a proper assessment and a history of the patient. Certain minerals, a detoxification of the body. So we do a lot of things to literally stimulate the body to heal itself instead of just covering up the symptoms. And that's the difference between medication and actually healing the body. Does that make sense?
Yeah, it makes perfect sense. So your approach is basically having the patient understand that, hey, the problem may not be what you think it is. Let's get to the cause. It could be diabetes, could be cardiovascular disease, could be stress, could be drug abuse.
Exactly.
Things of that nature.
You hit the nail on the head. Yep, exactly. And so we get down to the root cause of the problem, and then we try to fix it. And we fix the problem instead of just covering up, masking the symptoms with medication.
Okay. I have also another one. I have a lot of, like I said, older friends who come and they ask me these questions, and we get to having discussions. Most times over alcohol, is probably not a good idea anyway. It's probably the reason why they have a problem. But they have a lot of stress when it's time to be intimate with their significant other. They have a lot of anxiety and almost, I want to say, and I'm not a doctor, so like almost like a PTSD when it comes to it. What would you say to help someone in those situations who just, they don't want to get help, they're afraid to talk about it, and they're just having stress, they're having anxiety, they're almost having like a PTSD, or they almost sometimes are feeling like they're in a depression?
And is it because they're afraid of how they will perform and whether or not they would have an erection? Is that with the stress? Is that
yes, that's mainly, I think, the focus of it is to figuring out exactly what's going to be the outcome this time, because some days are better than others, some days are worse than others, and they get into the situation right at that time, and it's like, well, I underperformed, what's going to happen here? And they're so stressed, and they get this anxiety that they stay away from they stay away from sex all the way as much as possible,
Mm-hmm. You know what, that is another very, very good question. First of all, what I would really condone and encourage is for these people to obtain confidential medical advice. Where it is confidential. I want to remind people that this is very common. The issue of erectile dysfunction and sexual dysfunction, and whatever the cause may be, it is very common. More common than you think, and more common than most people think. So it's nothing new. It's nothing to be ashamed of. It happens in both men and women for many different reasons. And I would encourage people to obtain confidential help and talk to a physician, okay? And even if they want to find a confidant and share with someone they trust, a friend or whoever it may be, even just talking about it sometimes is very, very therapeutic. So it's a matter of catharsis, you would hear in the psychological terms, where you're sort of getting it out and you're getting some kind of support, even though it's not medical. Even talking to a friend is very, very therapeutic and healing for some people, depending on what it is that's happening. So I would first of all really encourage people not to be ashamed, because it is very common, and to obtain confidential advice and medical help. And there are a lot of options, very safe and effective and economical options to fix the problem for a better quality of life. We're talking about quality of life, and when it comes to being intimate with a partner or whatever the case may be, it's about quality of life and having the best quality of life possible, whether you're in your 20s or in your 60s and 70s. So I see across the board. I see all kinds of patients across the board.
Awesome. Thanks for answering that. I have one more that's on the charts, and this comes to a treatment that I've heard about lately in discussing this, and I've heard about this is the vacuum pumps. I don't know if you're familiar with it. I want to really know how safe those are, and I'm pretty sure you're familiar with the vacuum pumps that are being used as treatments in this area. And just want to know, are they safe? Is that a temporary fix? Will that help us in the long term? Just kind of want to figure that out.
Yeah, that's just, you're full of great questions. The vacuum pump is a temporary fix, absolutely. Okay, it may do the trick for the moment. It hasn't been shown to really grow size permanently. It hasn't been shown that at all. And even to obtain and maintain an erection, you may have an erection, or a patient may have an erection, but it won't last. And it doesn't get to the root cause of the problem, And so it is a temporary fix. And you brought me to a really good point with stem cells, and that is that it is possible with stem cells to not only fix the problem, but even grow size, length and girth. And the degree of the increase in size, I can never predict that. Nobody can ever predict that. But for sure, because we see a reconstruction of tissues and a regeneration of tissues that may have been damaged, or increasing in blood vessels in the area, whatever the case may be, we have indeed seen a measurable increase in size and girth. So, and with stem cells. So, with the vacuum, again, it is a temporary fix, and in the long run, it can do more damage than good. By the way, because it can actually do damage to the musculature as well as the blood vessels and even the nerves. So, where we have a decrease in sensation and things like that over time. So it is something that can be worrisome in the long term.
Perfect. Thank you for answering all of my questions that I've had so far, and I'm gonna definitely, in my next group session with my guys, I'm gonna make sure we talk about this, all the things that you asked for us, and hopefully we'll have some better understanding of this topic. You're also teaching me about the topic, so that was amazing. Thank you.
You're welcome.
Now, Dr. Zahra, since we're talking about the vacuum, does it also mean that people that usually masturbate and things like that actually have that issue? Because the vacuum and masturbation is kind of like have the same movement, if you want to call it.
You know what? The thing about masturbation is it is much more gentle. It isn't. Some of the vacuums can be very aggressive, and those are the ones that I'm talking about. Are the ones that are very where the suction is extremely high, and it can be very aggressive to the point where there can be damage. Sometimes with over masturbation, there can be damage and also deformities, and with the penis, where it's not completely straight or whatever the case may be, and there are deformities, and a lot of men complain about that, and so there is that risk also with over masturbation and with overuse of the vacuum, and that again is something that can be corrected with stem cells. They are deformities and aesthetics per se, and with certain diseases like Peyronie's disease, where there is a deformity, and also with certain structural damage from over masturbation or using machines such as the vacuum.
So in the case of women using all the sexual toys or things like that, do they also have that problem that they're in somewhat or somewhere doing damage to the tissue as well?
Absolutely. When there is, certain toys, as we call them, and certain apparatus that are used by women, definitely with overuse and with different sizes and things like that, there is definitely not necessarily deformity, but damage and some degree of destruction of the tissues, and so that would definitely have an effect on sensitivity and the ability to have orgasms over time and in the long run, and different issues. So yes, that is another very good point, Francis.
So So there you go, Ricardo. You can also say to your female friends about that not only the men will suffer, but also them by over pleasuring, if you can call it.
Let's try telling a female that I'm taking her toy away. She might shoot me. It's gonna be horrible to say that.
No, I mean it's not taking it away, but at least if they having some type of issues when by overdoing it, now there's a solution as well. So.
Yeah. No, I know. I'm just joking around.
Yeah. A good thing that we were talking over the past podcast is that in the meantime, there are solutions like changing your habits and in food habits, basically, and other things that they can do. And also, I would like to state out that if they need some type of consultation, they can do it with Dr. Zahra over online, a Zoom call, or actually using the video chat that we have for her, and as well. So
and just to reiterate that we do free consultations. Everything is very confidential, and so there is no obligation in obtaining information and doing a consultation.
Awesome.
So we will also include in the description of the podcast some food recipes or things like that people can actually use in the meantime, and we'll also put the link where they can request an appointment if they would like to. And as before, if you want to leave any comments or questions, you're more than welcome to actually go to the website or leave it here on the podcast channel or the social media channels. So, well, thank you, Ricardo. Hope to see you next time.
Yes.
Talking with Dr. Zahra, we have other topics, and again, you and I talked a lot, and I think that we know a lot of people that are looking for solutions for basically anything, doing it naturally, and this is one of the most common topics that we hear, but we'll go from there. And thank you, Dr. Zahra, for your time. And
yes,
we're looking forward for the next podcast.
Absolutely. Thank you so much for having me. Pleasure, Ricardo and Francis.